Hi, welcome to another episode of Talking with Docs. I'm Dr. Brad Wiening.
And I'm Dr. Paul Zalzal.
On today's episode, we're answering a question from a viewer about antibiotics around and after the time of total joint replacement.
Actually, I emailed that question.
Okay, good question. Thanks for the honesty. So, people wonder, what is the deal with antibiotics around surgery? The first point I think that's important to recognize is in the modern world, routinely you would get antibiotics both 1 hour before surgery as well as for one dose or possibly 24 to 48 hours after surgery in a routine basis.
Right, that has been shown to minimize the chance of surgical infection.
And the reason that is because we all have bacteria that live on our skin, and even though we clean the skin before surgery, there's a possibility that that could be introduced into your bloodstream or into the wound and stick to the implant.
Right. So the debatable question is whether or not to take antibiotics before you go to the dentist to have a dental procedure if you have a hip or knee replacement in place.
I get asked this all the time. What do you tell people, Paul?
Okay, so we used to say, for the rest of your life, everyone used to say this, for the rest of your life, before you go to the dentist, if you've had a hip or knee replacement and you're having any procedure more than just a checkup, you should take antibiotics either an hour before or maybe an hour before and an hour after. However, more recently, there's been some statements put out by some committees and associations that say you only have to do this for 2 years after a hip or knee replacement.
So, yes, I've read the same things. What I tell my patients, though, to be honest, is I think it should be lifelong for a bunch of reasons. They say, well, why? And I say for probably 3 main reasons. One, because the risk of the treatment is very low.
Taking an antibiotic is very
by
low
mouth
risk.
The risk is very low. The cost is very low. These are common antibiotics and they don't cost very much. And the consequences of getting an infection in your total joint is very high. It is very uncommon, thankfully, but if you do get an infected total knee or total hip replacement, usually the end outcome is that has to be taken out in one or multiple procedures, which is a huge deal.
Right, we've talked about that on another video on infected total joint. It can be a huge impact on your life to get an infection. So the risk of taking an antibiotic before you go to the dentist is very low. However, the potential outcome if you do not do that can be very devastating. Now, the evidence, I think it's the American Dental Association says, there's no evidence to say that taking antibiotics beyond 2 years is of any benefit. So I would agree with that completely. However, we don't have any evidence. The fact that we don't have any evidence to say taking antibiotics beyond 2 years doesn't mean it is good or it is not good to do that. It just means we can't prove it yet, but maybe one day we will. So personally, if I had a hip or knee replacement, which I'm sure I will one day, I will take antibiotics for life before I go to the dentist.
But yeah, important to be aware, very controversial. Some people say 1 year, some people say 2 years, some people say life. So discuss that with your surgeon and come to a joint decision together. Specifically about the antibiotics, Paul, what antibiotics do you give them?
Most commonly for the dentist, we would say amoxicillin.
Yes.
And of
just
course,
a pill.
Yeah, it's just a pill. And then, it's not only the dentist, actually. If you have any sort of surgical procedure, a mole removed, or if you get a cut or a laceration that needs stitching, anything like that, and you have a hip or knee replacement in place, you should go on just a short course, 1 or 2 dose of antibiotics, and then it might be something like a cephalosporin.
Sure.
Something like that.
And the reason that dental procedures are important is because our mouths are dirty, and when they're doing work in your mouth, the bacteria from your mouth end up in your bloodstream, and that blood goes to your hip or your knee, and it can seed your knee. That's why it's a risk. One other specific thing that's very, very common is people that have a documented or possible penicillin allergy. I want to tell those people.
Good point.
Because it becomes complicated then, a little bit more.
Yeah. I think it's important to, if you think you have a penicillin allergy, get tested for it and find out for sure, because there is some cross-reactivity with other kind of antibiotics. So if you think you have a penicillin allergy, you may be precluded from taking a variety of antibiotics that can be very helpful if you do develop an infection.
Yeah.
So you want to make sure you actually are allergic to penicillin before you put that down on your chart or let anyone know about that. And it's easy to be tested.
Yeah, get your family doctor to refer you to an allergist, and it's just like a little pin test. Get tested.
All right.
All right.
Thanks for the question.
And if you have any further questions, feel free to email us at talkingwithdocs@gmail.com.
And remember, you are in charge of your own health.
See you next time.